Hello, welcome to Health for Harm. I am Yusuf.
And I am Hoda.
In today's programme, we're going to cover a special report focusing on health inequality and its impact on people and the services they receive.
Our team of research on the ground in London have spent several months interviewing service providers and service users. These interviews have focused on exploring people's experience accessing healthcare and how service providers ensure the quality of their work meets the expectation of the public.
Thank you, Hoda. This research was an exciting opportunity for young people which has identified the health inequalities and the service deliveries in London. The project had 2 phases. The first phase involved 5 supervised workshops to develop research capacity, and the second phase was the implementation of these skills to conduct health inequality research across London. The workshops were held both in the Ogaden Community Centre and the SAMEC Trust Centre. The workshops included customer service and marketing techniques, research methodology and data analysis, research questionnaire design, progress review, and data presentation. The youth have learned a wide range of skills, including teamwork, communication, presentation, time management, and research methods. Here are some of the young people that participated in the project.
I'm Ahmed. Today we're doing some practice interviews and I really enjoyed it. I learned that you should smile and look at their eyes when you're asking them the questions.
Hi, my name is Hani, and today I overcame doing interviews with service users, and it gave me an insight on what questions and stuff to ask, and it was good practice, and I really got into the role and that's it, and I quite enjoyed doing what we did today.
Hi, my name is Sana, and I really enjoyed the session because I learned that within the interview you could ask different questions, different to the guidelines, and having this natural flow within the conversation, within the interview, just gives you more insight and gives you more information which would be useful. And
Health tourism is a term often applied to people from outside of the UK who come here to access NHS services. Interesting research has revealed significant numbers of individuals go abroad for their healthcare. People might be surprised to hear this. Our reporter Naima will tell us more.
Thank you, Yusuf. Research carried out based on approximately 200 people across London has shown a significant number prefer to travel abroad to receive healthcare, Germany being a favourite destination. Here's a short clip to show the experience.
Fatima! Sana! Oh my god, hi! Oh my god, we should hug! Thank you so much! I haven't seen you in a long time.
Oh, I'm good, just catching up on deadlines. How about you? How have you been?
I'm good. My mom, she's worrying me a lot. Her heart condition got worse.
Oh no, what did the doctor say?
They did the usual thing, they put on the waiting list, but it always takes a little bit longer to go through the system,
What else is there to do? I mean, she needs the treatment.
I know, right? That's what I thought. So I actually went ahead and transferred her to Germany, because they've got much shorter waiting lists. So, and she needs that right now.
Yeah, I know what you mean. When I had my ear infection, it took me 2 whole weeks to get an appointment just to be told that I need to put olive oil in my ear.
What? Olive oil?
Yes.
Have you ever been frustrated not being able to speak to someone in person? Well, you are not alone. Our research has identified a significant number of customers prefer speaking to a living, breathing human being.
Automated customer services are a nightmare that we've all experienced. Our researchers have interviewed many people that are unsatisfied with the lack of human contact when accessing their local health service providers. This is a common problem faced in many other industries with never-ending options that circle. Our reporter Naima has more on this.
Now I'm here with Abdul Fattah, who will tell us his experience with automated customer service.
Please press 1 to hear the concise answer. Please press 2 to hear the long extended answer, or please press 3 to hear these options again.
Thank you, Abdul Fattah. That sounded familiar.
I think we all agreed that access for the disabled should be a priority for all health service providers.
Oh my God.
Perhaps it is then surprising that the burden is placed on the user to inquire if there's suitable access. When is the last time you felt satisfied with the service that you received from your GP surgery?
Hello,
Hi.
I'd like to book an appointment.
All right. Okay, let me see what's the date available. The next day free, it's on Friday next week at 10 o'clock. Would that be all right?
That's fine.
What is your name, please?
Ada.
And would you like any female or male doctor?
A female doctor, please.
Female doctor. That's all done for you.
Okay, thank you.
Thank you. Bye.
A simple question as part of the initial interaction between service providers and service users can prevent some very embarrassing situations arising.
Come in. Hi, hello, welcome. How are you?
Hello, I was here to see a female doctor.
You booked an appointment with me?
Yeah, but I thought you were a female.
That's not a problem, we'll reschedule for you.
Okay, thank you.
Bye. 17% of those interviewed said that they could not get through to their GP over the phone. 53% of those interviewed said that they were not told how long they had to wait to see their doctor, whilst 31% waited longer than 30 minutes to be seen.
Did you know that there are over 100 different languages spoken in London? There are as many as 300,000 people living in London who can't speak English at all, and nearly 1.7 million people who do not speak English as a first language.
I am here on the grounds reporting the issue of health inequality in London. I have here with me Zainab. Zainab, research has reported that over 300,000 people in London cannot speak English. What do you think about this?
That's right, Fatima. 78% of the population in London have English as their main language. However, the remaining 22 do not. This raises issues in health equality as they are unable to communicate their needs directly with their doctors and healthcare professionals. Even with translators, the issue remains. Therefore, this needs to be addressed.
Is the onus on the individual or the service provider to identify issues on personal and cultural preferences? Researchers highlighted some cause for concern.
This is a fascinating and revealing research that is often ignored. Many of us lack the confidence to communicate our preference to service providers in fear of longer waiting time.
I want to tell you that she said she's got a headache.
A headache? I thought she said an awful lot there. Are you sure?
She's only got a headache.
It doesn't seem too bad. What I would say is you should just drink a lot of water, take some paracetamol and get a lot of rest. So take this to your pharmacy.
أولها بيعد عن بيعد عن أولها نفس and then after كبعدي وبيعاني الدكتور.
Our special report today has highlighted some of the key issues relating to health inequality faced by members of the public in London. This has been a fascinating research project led by young people keen to contribute to their local community.
The Ogaden Community Association, in collaboration with the SAMEC Trust, have been working on this youth-centered project. Our priority was to find young people who would benefit from the project by giving them the opportunity to develop different skills such as teamwork, communication, presentation and time management skills, as well as basic skills of how to design and carry out a piece of research. They had the opportunity to get involved in their community and gain an insight into health inequalities that exist in London. The project also allowed the youth to influence the health services provided by increasing an awareness regarding the access to health services and exploring ways to improve these services. The project has been successful both in terms of the skills the young people gained, which will be beneficial for their future development, and also in terms of improving health services, as the research has revealed an interesting facts that could have positive impact on ensuring equality regarding access to health services if implemented. I would like to take this opportunity to thank all those who were involved in this project. Especially, I would like to thank the young people for their hard work and dedication throughout this project. I would like to also thank the SAMEC Trust for making this possible.
My name is Gary Long. I'm from the SAMEC Trust, which is a national health charity based in Wembley. SAMEC Trust believe the successful integration of the increasingly diverse communities is vital to a successful, healthy and cohesive society going forward. We are proponents of co-creationism, believing in the empowerment of service users to take an active role in shaping the services that they receive. And this is why this project is so important to us, working with young people and placing them at the centre of a learning experience, undertaking a piece of research which they will design and deliver and report on, looking at health inequalities in their communities. Our sincere thanks to the young people that have played a part in this project. Their energy and enlightenment has been terrific to see. Sincere thanks to them. Also, I'd like to thank the Ogaden community to have been terrifically supportive of the project, and Brent Youth Services, particularly Abdi Mohammed and his team, again tremendously supportive. I would also like to thank the Lottery Fund itself for funding such projects as this. It does make a huge difference to have access to funds that really can deliver this kind of project at grassroots and empower people that don't always have a voice to have that voice. As I've said before, we learnt a lot through this process. Hopefully the young people will have learnt a lot. We've developed new partnerships, and this lottery funding has enabled us to do that. So huge thank you to the Lottery Fund for supporting us through this process. Thank you.
We hope you found this special report informative, and we hope service providers will address the issues raised in this programme.
Thank you for watching.
My name is Ladan, I'm 17, I go to Chiswick School and I want to become a doctor.
My name is Yusuf Malim, I attend the Heathland School and I'm an aspiring engineer.
My name is Naima, I go to Chiswick School, I study maths, chemistry and physics, and I want to be a doctor.
My name is Sada, I'm 17, I go to Oxbridge College, I'm learning health and social, and I want to become a midwife.
Hi, my name is Abdi Fatah Yusuf, I go to Hatchin High School. I want to study A-level, studying maths, physics, chemistry and biology. My ambition is to become an engineer.
My name is Fatima Guled, I'm 16, I go to Greenford High School. I study business and economics and psychology at the moment. Next year I'm hoping to do biology, economics and maths for A-levels and do accounting at university.